Hello, I'm Karen, back here with our Ask the Expert show, and I have Dr. Dahmer of Family Chiropractic Center for Wellness here with us today to talk about the positive changes that chiropractic can give you in your life. Hey, Dr. Dahmer, how are you?
Good. How are you doing, Karen?
I'm doing great. So you actually have two offices for your practice. You have one in Spring Hill and one in Hudson.
Correct.
So tell us a little bit about yourself and how long you've kind of been in the industry.
I've been in this profession all my life. My father's chiropractor, my uncle, my aunt. I was raised in it. I really didn't want to do chiropractic at the beginning. I wanted to go a different path, but you know, something kept bringing me back to it. I saw all the great results that my father had gotten with patients, and I just decided, you know what, I want to give that back to my community and to other people. So I went to school. I went to Palmer in Iowa, where chiropractic started. And you know, I came out and bought one of his practices and opened a second of my own, and have been helping people ever since.
There's a lot of misconceptions out there. You know, is chiropractic safe?
Sure. Well, you know, people have questions all the time. A lot of it, though, I find is just either from the media or a friend, and they've never even actually tried chiropractic themselves. And so what I say is, listen, if you've exhausted all your other avenues and you're still in pain, why not? You know, and it's one of the safest, most effective ways of alleviating neck and back pain out there.
What are some of the common treatments that people are usually directed to when it comes to neck and back pain?
You know, the first thing that most people do is, you know, they try to sleep it off, right? And they figure, you know, I hurt myself and I just need to rest, maybe stop, you know, working out, or, you know, even take a couple days off work maybe and see if that resolves it. And that may happen first couple times, but the problem is the pain ends up coming back. And a lot of times when it does come back, it's more severe. Some turn to medications and try to decrease symptoms so that they can get through their day. There's definitely a time and a place for medication, but generally it's crisis care, and it should be short term.
How many people are you seeing coming in overloaded with prescriptions?
You know, Karen, it's been a problem, especially in Florida. You know, oxycodone alone, 650 million pills prescribed in 2010. And the death rate has increased because of these prescriptions, because of kids and other people getting them on the street, snorting them and turning them into a street drug. Are you getting healthier by this process? And I have to ask them that. Or are you masking and covering up symptoms just to get through your day?
So what happens like when they are cracking down, and unfortunately these people that have been taking prescriptions for so long because they don't know that there's other options out there, what is their resort, what are they turning to now?
When they come into the office and they're starting to cut their pills in half and trying to make them last as long as possible, and I say, listen, you know, let's find out why you're having the pain. And chiropractic's all about the nervous system. If there's a bone out of place pinching a nerve, it interferes with the function and they have pain. So my job is basically to see if we can adjust the spine. We help them, we get them out of pain, and we try to get their body healing themselves and send them back to their doctors, get them off of the medications, and just live a healthier lifestyle.
So sometimes people get to the point where they do have to have surgery to alleviate some of the pain. Is it safe to get chiropractic care or adjustments after you've had surgery?
It's a great question, Karen. You know, it depends on the region and the extent of the surgery. I mean, we can address the segments above and below the surgery and adjust them safely. Of course, we get clearance from the surgeon, make sure everything's fused and healed.
So most people, you know, when they think of chiropractic care, they think that, oh, I have to go like 3 times a week, or I have to, you know, it's something that I do forever. What would you tell people that have that conception that it's just, you know, not worth it?
Sure. You know, it's important with any professional, whatever you're doing, to have a plan and a goal. When I bring a patient in, I say, listen, if we're gonna get from point A to point B, this is what it's gonna take. At the end of this, I expect you to be pain-free. Your spine should look like this. We're gonna take a pre and a post to show the changes. And then after that, you know, wellness care. Maybe once a quarter, pop in just for a wellness adjustment to keep your spine healthy. Because people are always going to have stress in their lives, trips, falls, car accidents. But as far as the care, there is a beginning and there's an end to a care plan. And it's different for each person. It just depends on what they present with.
People are always, you know, out there doing things, they slip and fall. But if they're getting hit on purpose, you know, like in football, or if they're running up and down, you know, the basketball court, you know, how can chiropractic care help them perform at their best?
It's not necessarily good to push through certain injuries. And so if we can be proactive and get people as healthy as possible before they start the sport and during the sport, they're less prone to injury. And so that's the name of the game, is to start healthy, check them through their activities. I mean, there's chiropractors and healthcare professionals on every sideline in the professional arena. And there's no reason why the kids here in high school sports and college sports can't have that same care.
What ages do you help with children in sports?
You know, we help all ages. Obviously, there's different goals depending on the age. You know, I mean, in the high school years, we're looking for scoliosis and genetic things, and obviously there's going to be more contact at that age in their sport. You know, when they're younger and toddlers and tripping and falling, and I mean, we're just basically making sure that they're aligned for the massive growth spurts that they're about to hit. And it's always good to check them from there. So really all ages, it's just the goals are different. The earlier obviously that we get a hold of them, the more correction can be made.
Where can our viewers follow up and find out more information about you and chiropractic?
The easiest way is to go to our website, drbrianchiro.com, and both offices are there. We have directions and testimonials on our website, so that's a great place to start. If they ever have any specific questions, I answer my email every day and love to connect with people.
Okay, and as we wrap up today, you know, you want to share with us why chiropractic care is so important to you and why it's important for you to get the message out to people of how it can change your life.
You know, I think the number one reason is that we have a productive society. I want to see people that are proactive in their community, and the only way that we have that is if we have people that are healthy and feeling good and are active. If there was anything, I want to get people back to health naturally, one spine at a time, and then just coach them to a better lifestyle.
Okay, well, thank you for coming today, Dr. Brian,
Yes.
and make sure that you follow Family Chiropractic on Facebook so that you can stay in tune with all of their tips and stuff that they have coming out, and we hope to see you on the next episode of Ask the Expert.
Thank you.